So first and foremost, you need to create partnerships with hospitals and payers. Uh, Obviously, patient volumes come from hospitals for the most part, and the post-acute environment, and referrers have a significant influence and sway on that. And so you have to create a compelling value proposition for working with those hospitals, with your referrers, and with your payers. And so that is step one. And there is obviously a lot of different elements to what that process looks like in terms of tracking your own data so that you can present that in a meaningful way, creating compelling value proposition, understanding who the right individual is that a referrer or payer to connect with on any given initiative. But big picture, number one is create those connections with your hospitals and payers. Number two is get your staff on board. We didn't talk about this enough today, but nothing that we're setting out to try and accomplish in the future is going to get done without our staff, and in particular our frontline staff, our caregivers on board. They need to understand why these changes are happening, and they need to be bought into those changes and reflect those changes in the way that they deliver care and the way that they build skills such as critical thinking skills that are more important as you take on a higher acuity and more complex patient population. So that's action step number two, is get your staff on board, create an engaged culture of performance improvement from a quality side. And then I think that leads into the third and final recommendation in terms of action step is determine what are your clinical specialties going to be. You're not going to be all things to everyone, or even if you are, you still need to have certain areas where you spike as the really strong performer. And so you need to have an honest assessment about what your clinical capabilities are at your organization and figure out where do we build a specialty program around that can really differentiate us in the market.